My name is Lloyd Zucker. I am a neurosurgeon. I am one of the partners in the Brain and Spine Center of South Florida. We're here today to talk about the sacroiliac joint, how to diagnose problems with the sacroiliac joint, treatments for problems with the sacroiliac joint, and finally, surgery of the sacroiliac joint. The sacroiliac joint is between the bottom of the spine and the pelvis. It is a large joint. It is covered by many ligaments. It can produce pain like any of the other joints in the body, and it is often, unfortunately, overlooked when we talk about back pain. If we look at patients that just present with low back pain, 15 to 30% of those patients that are presenting with low back pain or pain that is in the back and in the leg can have the sacroiliac joint as the generator of that pain. Well, sacroiliac joint pain can be caused by a variety of things. It can be caused by trauma, and with pregnancy, those ligaments can soften. To me, SI joint pain has some common things, and at other times, I think it's a chameleon. There's pain in the low back, it can be pain in the buttock, it can be pain off to one side, it can cause leg pain, it can cause groin pain. In that way, it can overlap with a lot of what is considered spine pathology, so provocative testing and diagnostic workup, MRI, CAT scan, plain films, all become an important part of the workup to try and isolate where the actual generator of the pain is. The classic thing that I see when I walk into a exam room is a patient sitting in a kind of a skewed position, trying to offload the joint. Sacroiliac joint patient often has the Fortin sign, where they point to a particular spot on their back, which actually overlies the upper part of the sacroiliac joint. And then there's a number of maneuvers that you can do. And if I'm homed in on the sacroiliac joint, there is a fairly definitive test, which is the sacroiliac joint block, where local anesthetic and usually steroid are injected into the sacroiliac joint. To me, a successful block means that when a patient has the local anesthetic placed into the sacroiliac joint, that they have complete or near complete resolution of their pain. A diagnosis of sacroiliac joint dysfunction does not immediately mean surgery. There are physical therapy, osteopathic and chiropractic things that can be tried to see if the joint can be realigned. A ablation of the nerves that lead to the joint can be attempted. If it's non-invasive, I have no problem with trying it as a prelude to making a surgical decision. Patients often say to me, when will I know when it's time for surgery? And the answer there is really when the discomfort is interfering with the activities of daily living, compromising those activities of daily living, and when conservative treatment has failed, then surgery can be a consideration. The sacroiliac joint fusion that we do in the present day is a minimally invasive fusion. It's done through about 1.5 inch long incision on the buttock. It's guided either by fluoroscopy or by an intraoperative CAT scan, and uses an implant that fastens the sacroiliac joint by passing through the ilium and the sacrum, crossing the joint and holding the joint together. We usually try and use at least 2, if not 3, of the implants. The physical surgery itself takes around an hour. If any of the things that we have described, the symptoms, the signs, the pain, are things that resonate with you, we would be more than happy to see you and assist in the diagnosis.